Hello, welcome to my channel. My name is Ify. Welcome to the Knowledge is Power channel. This is where you learn things that are bothering you. We share some little knowledge in here. So today I am going to continue with part 2 of the knee pain. So like I talk about the causes of the knee pain, how to diagnose a knee pain. And today I will be talking about the symptoms and the treatment of knee pain. Okay, so the disclaimer, so this does not mean this is how you treat yourself, or this is what you have to do. If you still have a knee pain, you need to see your provider. Okay, you need to see your doctor, your provider, whoever that your personal primary care doctor is. So this is a knowledge-based video, so I just want to put this ahead of time. So I am not going to be held responsible. You need to see your provider for more details and treatment if you are having a knee pain. Okay, so today I'm going to be talking about some of the symptoms and the treatment that you have to do for knee pain. So for knee pain, one of the symptoms is swollen. You see the knee swollen. You have a stiffness on the knee. It also feels some redness. You can feel some warmth when you touch it. You feel that knee is warm, and you also feel a cracking and popping noise. You can feel that also. And then there is this inability for you to straighten your knees out or bend it. So that is one of the stuff that you're going to feel with knee pain. So one of the stuff that is when you can't bear it, it is time for you to see a doctor. If you're having a mark on the knee that is swollen, it's time for you to see a doctor, your provider, your primary care physician that is taking care of you. He may be able to refer you to an orthopedic doctor if they need, after doing an MRI or CT scan or an X-ray. If it's something that they will not take care of there and then, he will be able to refer you to an ortho doctor or a neurosurgeon, just depending on how the case may be. If you're having a fever with the knee pain, it's time for you to see a doctor. If there is an obvious deformity, it's time for you to see a doctor. If you're not able to enter or move the leg, straighten it out or move it, extend or shorten it, bend it, it's time for you to see a doctor. So one of the ways in which knee pain is treated is we use something like a corticosteroid. We also use the PRP, and it could be surgery. So the PRP is plasma. So they usually draw your blood, spin it, and extract the plasma and inject it back to the knee, which usually help with a lot of healing. And there is not a lot of side effects with using plasma, because actually it's your own blood that they're using for it. So depending on what is going on in that knee, usually if you have something like a tear, the PRP, the plasma, is usually a very good fast healing process or procedure or medication that is injected there, which helps with the healing so fast. The last resort is usually the surgery. It's usually going in there to open it up and stitch it up and join it. And that I will consider a very last resort. After you have tried the corticosteroid, you have tried the PRP, and then you have tried all that, then steroid will be the surgery will be the last option. It's usually the last option. The steroid, it's also it's a good one. I think I didn't elaborate on that a little bit. The only disadvantage with steroid is that if you're diabetic, it usually will increase the blood sugar of the patient. So be careful if it's a diabetic patient, in order not to increase the blood sugar. So sometimes we usually use like half of what is required. So those are the another reasons why I don't like steroid a lot. It does what it has to do. But come on, if you're in pain, sometimes we're like, whatever works, that's what you're interested. Let's worry about the other ones later. And finally, maybe you can use medication, things like there are Tylenol for arthritis pain, which is 650 milligrams, 2 tablets a day. And you can also use ibuprofen. You can also use Norco is usually the last round, but you know, the basic knee pain, this Tylenol and ibuprofen will take care of it. The opioid is something that we don't always like recommend, except on a very severe cases. One, because it will increase the opioid addiction of people. So because of that, we try to minimize or reduce how many times that is prescribed to a patient, you know, on a very rare occasion. Thank you guys. Make sure you share and give me your opinion on these videos. Bye.